The first of these next sections will be our conversation on how do we solve the problem of pandemics within the context of addressing the great challenges of building a global public health infrastructure that works for everyone. Our player coach and conversant will be Professor Larry Gostin, University Professor at Georgetown, in conversation with Barbara Stocking, the former CEO of Oxfam and Cambridge University College president, Precious Metsoso, the former South Africa health minister, and the incomparable Soumya Swaminathan, the chief scientist of the World Health Organization. Larry?
Well, thanks so much, Jamie, and it's such a pleasure to be with you in one shared world. And just listening to Renee, it was really full of love and inspiration. And we have to match that kind of love and mutual responsibility, respect for Mother Nature, admiration for Mother Nature, and ourselves as we face this pandemic. Jamie's asked me to moderate a panel. Can we learn from the pandemic's lessons, public health in an interdependent world? And so I'm going to just frame a few questions, and then I'll turn to our spectacular panel to really just have a conversation with each other and with you. So, what is the core problem to be solved? I mean, there are so many, but the core problem is, an unraveling of mutual solidarity, mutual cooperation. We seem to be, as individuals, too much geared toward, what does the world owe to me? Or as a nation, my nation first. And we forget that we have not just kind of rights as nations or individuals, but we have responsibilities. We have responsibilities to our family, our community, our country, our region, and our whole world to make it a better place. And that solidarity has broken down. We've seen it throughout the pandemic with the inequitable distribution of scarce medical resources. Fundamental things like personal protection equipment, oxygen, and now life-saving vaccines. Just yesterday, President Biden hosted a summit alongside the UN General Assembly on COVID-19, and focusing specifically on vaccinations. By the same chance, the US FDA on the very same day yesterday authorized third Pfizer shots, or so-called boosters. And so we have to ask ourselves, is the Biden model of charitable donations from the rich to the poor all right? Yes, we absolutely need those donations, but in order to scale up vaccination so that everybody's protected, we need to empower regional hubs so we don't just wait for donations that may come or may not come, but everyone in the world can have the power to create their own medical resources. And for that, we need to transfer the technology and the know-how. So what's succeeded and what's failed? The great success, of course, is scientific cooperation that got us to a vaccine in record time, under a year, when the quickest we've ever done it before is 4 years for mumps. And our key failure, of course, has been a failure of national and political cooperation around the world. And the singular failure, of course, has been one of deep inequity, the haves and the have-nots, those who have died disproportionately, those who have not have access to life-saving vaccines. But out of a crisis comes opportunity, and there are many opportunities that are now before us for a better, as we say, one shared world. WHO is going to host a pandemic treaty negotiations in the next special session of the World Health Assembly in November. There is a attempt to reform the international health regulations. We need to empower the World Health Organization as our leading organization. We need to strengthen its partnerships, like with COVAX. And most of all, we need bottom-up social mobilization and civil society voices to help lead this. I'm always inspired by the AIDS pandemic, where I think AIDS changed the world, and it was changed by the brave civil society advocates who literally required governments in the world to pay attention when they were not. And so now I want to turn to our panelists and ask you for your views about how can we get a deeper recognition of mutual responsibilities and a deep global interdependence to help us better address this challenge. And I think I might turn first to Soumya, who's, as chief scientist of WHO, has really been the singular voice of trust in science throughout the world. And so why don't you begin, and then we'll bring in Precious and Barbara.
Thank you very much, Larry, and also for the framing that you've just done, putting all of the issues on the table. I must say that when I look back over the last 20 months, there are a lot of things that have, good things that have happened that we must acknowledge and try to build upon. Just a couple of examples. Early on in February of 2020, we hosted the first global research and innovation forum, which brought together at that time physically about 400 scientists. We knew by then, of course, that this was a novel coronavirus because we had on January 11th the whole genome sequences of this novel virus on a publicly available database, the GISAID database. So I think that's a big change, that this was a pandemic in the era of whole genome sequencing and publicly available data. So we knew within weeks what the pathogen was. We, of course, then laid out a research roadmap, and since then have been engaged with thousands, literally thousands of researchers, scientists, doctors from around the world, meeting on a regular basis. Every week, these expert groups are meeting to update on the scientific knowledge, what we've learned. And of course, we're still learning so much about this virus. But in the first few months, it was really critical on a daily basis to update that information, initially coming out of China, clinical manifestations, what's happening with these people, what's the pathogenesis of the disease, what's the mortality rate, who's vulnerable, how do you protect, what are the treatments. This then led to, of course, clinical trials, and it led to a lot of absolutely unprecedented amount of research, collaboration, leading to the development of new tools, diagnostics, vaccines, and some therapeutics. I would say that this is a victory for science, is a victory for scientists who gave of their time and of their expertise so freely without waiting for anything. Everything has been out in the med archives and the bioarchive. Nobody's waiting, for glory in publications. So I think this kind of a mission approach can be used to solve some of our other big challenges, take tuberculosis or malaria or air pollution. We need to come together like this. I think it's unprecedented. Second, on the downside, of course, there was a huge proliferation of research, of description of varying quality. So you have, at the beginning, we were tracking on a daily basis the publications. A small team was able to do that. But in a few weeks, we could no longer keep up because you had hundreds of papers. And then you have on these archives things which are not vetted by the peer group. And so there's so much information out. You had the media picking up things even before they were peer reviewed and making headlines. And so then we had to start fighting this misinformation. At times, it's just out of a lack of awareness of good science versus bad science. But at times, it's disinformation campaigns as well, anti-science, anti-vax movements that unfortunately are seem to get the ears of people and the eyeballs of people. So we were fighting the pandemic, but also the infodemic. Third, I think what happened was with the development of the tools, even though WHO from the beginning was talking about the need for fair and equitable distribution and sharing from day one, from the time that we needed PPEs and masks and gloves and oxygen to vaccines, we've had a complete lack of global solidarity. In fact, it's been every country for themselves. And this is where I think the problem lies, because in a pandemic, you cannot solve the problem. And I think the same will apply to the other big existential threats that we face. We cannot solve it one city at a time or one country at a time. There has to be a global agreement. And this is, as you mentioned, the pandemic treaty that will be discussed in November. Member states need to come together and say, well, this is a global threat. This can arise in any country and it will spread throughout the world in no time. We know that we're all interconnected now. You cannot stop pathogens and viruses from spreading. How can we deal with this? How do we prevent it? How do we make sure that we have the best possible surveillance systems, that we're sharing data rapidly, openly? That's why we set up this new pandemic hub in Berlin. It's really all about data, information, and how to empower countries to use that data. And when we develop the tools, they should be treated as global public goods. They don't belong to any one company or one country. They need to be used to fight this disease. And you mentioned HIV/AIDS. We should have learned the lessons. We waited till 12 million people had died before antiretrovirals were made available to low-income countries. So we can talk more about equity, but this is the glaring things for me. On the one hand, so much of solidarity around the scientific community, they wanted to do the right thing. But when it came to political leadership, we don't see that commitment. Maybe it's coming now, but it's too little, too late, I would say. People are dying every day. Let's stop there.
Yeah. I mean, I think you've stated it exactly right, Soumya. The miracle of science and scientific cooperation and unselfishness was the best of our humanity, and the disinformation and the inequities was the worst side. Precious, I mean, we've talked about the AIDS pandemic and the COVID pandemic, and of course in South Africa, you've had both have been deeply burdensome, and South Africa has behaved inspirationally in many ways. I wonder if you could kind of reflect back to AIDS, what the lessons are that we might learn today, and what you'd like to see from your vantage point in Africa.
Well, thank you very much, Larry. South Africa is a very typical example of why something shouldn't happen. It shouldn't be that we have these inequities after we've had the HIV/AIDS experience. In fact, I call this terrible twins, the terrible twins of inequality and inequity combined. We've traveled the path of inequality, and we're also exposed to the inequities. And having traveled that, we kind of learned how best to deal with this. But I do not think that you've got complete solutions. My understanding is that no country is an island, and no country can do this alone. South Africa's response has been because of the collaborative initiatives of problem solving that we've seen. Collaborative initiatives between civil society, scientists, government. It is obviously not always possible to bring government on board, but if you set up mechanisms of coordination in the country, it works. We've seen it with HIV and AIDS, and we've also seen how an empowered community, empowered civil society can marshal forces and drive the solidarity movement. No country can do it without bringing on board scientists, civil society, and different actors. as well as a private sector. I think that we have an opportunity. We have an opportunity now to prevent the next pandemic by starting at community level. Let's build our communities. Let's empower them. Let's give them information so that they can help us. Pandemics start in communities and they will end in communities. So if we empower them, we're halfway there. I still am optimistic that this cup or glass is still halfway full. So let's deal with the empty half of the glass by resolving all of these issues. The global coordinating mechanism and governance is important. And the pandemic treaty is actually going to be a vehicle towards that. Let's invest in that. Thank you.
Yeah, well, thanks very much, Precious. And social mobilization bottom up is really what AIDS stood for, the HIV/AIDS pandemic. And as I say, I do think it changed the world, and we need to do that now. Barbara, both Precious and Soumya have talked about a pandemic treaty. Why don't I know you're the chair of the independent panel. I'm on your panel. Talk a little bit about what you think. What's your vision for a safer, more resilient world?
Okay. Well, first of all, I agree so much with what you said at the beginning, Larry, and others about the need for solidarity and trust across the world. But if I think, Larry, to just start with what exactly is the problem that the pandemic treaty is set up to solve? And if we go back into what happened in this pandemic, of course, one of the absolutely fundamental points about this is that we did not stop an outbreak from turning into a pandemic. We're not going to stop all outbreaks, but we certainly can, in working in the proper way, actually stop this moving to a pandemic. So what went wrong at the beginning? Well, clearly there was a lack of preparedness, and I don't just mean in public health surveillance systems or PPE, but actually I think there is something quite fundamental which relates back to what Precious was talking about, communities. There is not a great understanding of what happens when you move from an outbreak to an epidemic to a pandemic. People don't understand, and this includes governments, that's most important, the exponential nature of the pandemics taking place. In so many other areas, when you have a disaster, you deal with that then and there. Now, people looking at the beginnings of any pandemic will think, well, this is quite small. And that's exactly what happened with COVID here in 2020, in the February, when so many world leaders said, we must just wait and see. And with exponential growth, you really can't wait and see. And I think the public also doesn't have a good understanding of that either, which is why that comes back to Precious's point about making sure the communities are informed about why things happen, really. But so we had poor preparedness, and especially from the governments really understanding what you have to do to hold back a pandemic. As it got going, we found that the international health regulations, which are already a binding treaty, they weren't adhered to. So that was a problem. When WHO came out with early warning or the public health emergency of international concern, people did not do the things that they ought to have done, actually globally, but sometimes in individual countries too, to actually really take on the guidance of WHO. So why didn't they? What's going on? Well, the answer to that, which is in the treaty, is the idea that there should be compliance and there should be mechanisms that can actually monitor what countries are doing and whether they are adhering to proper good practice or to specific WHO guidance in that. And that's what the essence of a treaty is. It's to have compliance mechanisms actually built in, and for countries to allow people outside to come in and monitor them. And if something is not working, to really properly investigate and also take up the remedial measures that you need to do. Now, WHO has never been given the authority to do that. Even to enter a country, WHO has to ask for access. So this is a different way of operating, to say that we accept that we're not all going to do it right, each country, but we are prepared to accept outside people to come in and really look at what we're doing. Now, I won't go into lots of detail about, there are discussions about where a compliance mechanism should sit. Is it in WHO? Is it into a new body that might report in more to the UN? But it's the essence of that point that's absolutely key in this. But the final bit I just want to say is, well, why should governments go along with this? Governments see health as part of their sovereignty. Of course, that's right. Looking after your own people is one of the first things a government has to do. But as we all know and has been said, we can't look after our own people if we're not looking after the world. And I guess what I really hope is that this time it has been understood that people can't stand alone in their own country and just actually do what they individually think is right, when it's often against the scientific advice and so on. But we have to really work together and understand that we are in solidarity and need each other, both actually even now as we come to what we hope is a safer place as far as COVID is concerned, but certainly for new pandemics as they might arise.
Yeah, well, we've only got 1 minute, and let me just quickly sum up. That was beautifully spoken, Barbara. We've heard from Soumya about the importance and that science, health workers, scientists, they've been the heroes of this story right from the beginning. And we need to support them. We need to make sure that we have the kind of open access and scientific cooperation. We need to make sure that information is available, that's accurate, and that the public can trust. Above all, we need equity, as Precious has said. We need, as Martin Luther King said, all inequalities are unjust, but health inequalities are the most unjust. And then we need resilience. In the end, the only way we're going to get out of this pandemic and prevent the next one is if we're all in it together. If we all reach across our brothers and sisters in our communities, in our nation, in our world, and we all have a mutual hug, and we include Mother Nature in that and have respect for the awesomeness that she brings. In future, for me, the most important thing is next time, let's not just be complacent, but be prepared, and be prepared in a world that is healthy and a world that is just. And thank you, Jamie, it's over to you now. And thank you for giving us this wonderful privilege of being with you.
Thank you so much, Larry, Barbara, Precious, and Soumya. What you've said encapsulates the entire reason why One Shared World exists.